Hi, my name is Race Nelson. I'm doing the SVN competency, the small volume nebulizer competency. One of the main things we want to see before entering the patient's room is the physician's orders to see what the patient is going to be needing, what procedure, what medication, what dosage, and also what equipment you'll be needing for the procedure. Also, the patient's chart. You'll want to look at the first last name of the patient, the date of birth, and also the history of the illness, as well with any X-rays or any sputum sample that's been done previously, and any past hospitalizations, and anything that pertains to the patient. You wanted to know prior from entering the room. I'm going to be needing a stethoscope. I'm going to be needing my oxygen, pulse oximeter. Oximeter. I'm going to be needing some tissues. Some gloves, my BP blood pressure cuff, hand sanitizer, again the jet. I'm using this mask as well, aerosol mask. Okay, in case the patient prefers that. Okay, so I'm going to enter the patient's room and introduce myself, ask his name, date of birth, and all that kind of stuff before proceeding, and tell him about the procedure I'll be doing for the patient and the benefits of the procedure, and okay, and about the assessment before the procedure. Okay. Hello. How you doing? My name is Race. I'm from the respiratory therapy department. I'm a student at Hartnell College. Today I'm going to be administering a small volume nebulizer for you. It's pretty much going to open up your airways, okay? Help you breathe better. Can I get your first and last name, please? Charles Jones. Okay, and your date of birth? Okay, I'm going to go ahead and verify it on your wrist, okay? Okay, Charles Jones, thank you so much. I'm going to go ahead and, prior from giving you the procedure, the medication, I'm going to go ahead and assess your vital signs, because I want to see where you're at, your baseline's at before proceeding. I want to see your growth. I mean, how much you improve after all the medication, okay? At this point, I'm just getting my gloves on and getting ready to do some vital signs. I'm going to be doing the auscultation first. Okay. All right. Can I call you Charles? What do you prefer? Charles. Okay. Cool. Okay. I'm going to be checking your lung sounds. So I'm going to be checking your back and also your chest. So when you feel my stethoscope, do you mind? When you feel my stethoscope hit your back, go ahead and take a breathe in and breathe out. And yeah, just want to see your lung sounds, see how they're doing right now. Okay. Charles, if you can you reach to the left rail and pull yourself forward? Okay, if you could do that. Thank you. I'm gonna go ahead and help you out. Okay. I know it's hard. Okay. Push you just right up there, okay? All right. Thank you so much.
You do this, you have to have the patient hand it to you, right? So you look at it.
Breathe in. Breathe out. Breathe in. Breathe out.
Because she was
Breathe in.
doing it 3 times.
Breathe out.
Nothing, there was no...
Breathe in. Breathe out. Very good. Breathe in. Breathe out. Breathe in. Breathe out. One more time. Breathe in. Breathe out. Breathe in. Breathe out. All right. Thank you so much. Okay. Lungs. Back here. Thank you, Charles, so much. Lung sounds are okay. I did hear some kind of wheezing on the base lobes, but I think after procedure it'll be a little bit, it'll open up your airways. So Charles, I heard some wheezing. I'm gonna go ahead and I'm gonna give you the medication in a little bit, okay? I'm gonna go ahead and let me check your chest as well. Like I said, yeah. Do you mind if I unbutton? I mean, down the apron? Okay, cool. Thank you so much. All right. Breathe in. Very good. Breathe in. Breathe out.
Okay. 1, 2. Hi, my name is Shelly, and I'm going to be showing you
Breath. All right. Also, too, Ms. Smith, Charles, I'm gonna go ahead and check your cited lobes. Okay, I didn't check that, but I want to be sure that there's no. I want to further investigate the wheezing. Okay. All right, I'm gonna go down right here. Breathe in. Nice. One more time. Okay. It's again wheezing. Like the right lower lobe. So I'm gonna go ahead and so that's the oxygenation part. I'm gonna go ahead and check his pulse rate along with the oximeter, which gives you the saturation of oxygen and also the pulse rate as well. And also I'll be checking his respiratory rate at the same time. Okay. I don't have a watch for this procedure, but I do have a clock right there, so I'll be using that for illustration, well, for my help. Okay. Okay. All right. Charles, I'm gonna go ahead and check your pulse oxygen level. Okay, and read your pulse also, and your okay, and your chest as well. Okay, thank you. I'm gonna put this here.
And your date of birth one more time?
Oh.
All right, that matches. Thank you.
Okay, thank you, Charles.
Can I call you Ruby? Yes. All right. So first.
That's great. You know what? That's fine. I'm gonna put that there.
I'm going to check your vitals.
Find his radial artery. Thank you, Charles. I'm going to go ahead and put my hand on your chest. Okay. I'm gonna go ahead and count to 15 seconds.
Yep, there's not available storage.
Okay. All right. Thank you, Charles. I'm going to I'll be right back. Thank you so much. I'm gonna go ahead and write down numbers down here. Pulse was at 20 beats in 15 seconds. So times 4 equals 80 beats per minute. Beats per minute. His respiratory rate was at it was at 5. So times 4, that's 20 breaths per minute. So that's within the normal range, and saturation was at 98. So far it's pretty good. It's okay. Okay, so now I'm gonna go ahead and give him the treatment. Okay, so all right. And give him the treatment for the blood pressure. Okay. All right. So again, I'm going to check your blood pressure. Okay. That's right here. You want to make sure it's not too tight. If it's too tight, you can't get your stethoscope below the radial artery. So you want to make sure it's kind of loose. And if the patient could, if he was able to, I would ask the patient, he or she, to if he could hold the meter here. And also as well, if the patient's female, you want to be sure not to, we want to be sure to ask permission to, to remove any gowning before proceeding, because you just have it's polite to respect people's privacy, especially if they're women, you're a male. Okay, so this patient's unable to hold the meter, so I'm gonna go ahead and hook it to the scope here. Right there. All right, just stay still, Mr. Charles. Thank you so much.
I'll tell you that I'm going to be teaching you how to do from your dose and flavor, that the medications are albuterol. Oh, because you can't hear it.
Yeah, patient's blood pressure was at 135 over 90, so it's heart's working a little bit more than it should. I think because it has that wheezing, it's making him, his lungs work faster, heart demanding more oxygen, so it's pumping more blood. So his BP is a little bit higher than usual. So maybe after the treatment, it might reduce. Again, I'll do the assessment after the treatment again, like I just did. So now I'm gonna use the. I decided to use the aerosol mask. Patient seems to not be able to have poor coordination, a little lethargic, I guess. So I'm going to use this option. I think it's best. Beforehand, I'm going to add the medication in here. The medication that was on the physician's order was albuterol, atropium bromide, so 2.5 milligrams. So I'm going to go ahead and administer that. Usually it comes in a capsule, so you put that in here. And be sure not to touch anything within this realm because you don't want any infection, any contamination to come about. So pour in here medication, okay? Afterwards, get this top here. Okay. All right. And then at this point, I'm gonna go ahead and attach the tubing to the generator here. For this device, between 6 to 8 liters per minute. So I'm going to do that.
So first I'm going to review the patient's or the doctor's order to make sure I know what I'm giving it to the patient. Next I'm going to review the patient's chart. I'm going to see what their chief complaint is. I'm going to check and see what their history is, any medications that they currently are on, any allergies that they may have, and also check their vital signs. Next I'm going to gather my equipment, make sure I have some hand sanitizer or wash my hands if I have a sink available.
Also to Charles, about this medication, I didn't mention, one of the side effects, it's like you'll get an increased heart rate, okay, and I'm going to go ahead and monitor that. Also, you might feel jittery or some nervousness, so because of the caffeine. So it's kind of like drinking coffee in a way, but it does subside. So I'm going to go ahead and have you wear this oximeter as the medication kicks in, okay? I'm going to monitor your heart rate. Okay? Do you have any questions or anything like that? Yeah. Well, again, yeah. Don't worry about that. I'll be watching your BP. If it goes above 20% blood, if your blood pressure raises above 20, I'm going to stop the medication, and you'll feel better afterwards. Okay, so.
Let's get some gloves on here. And again, you said your birthday was in January. All right. Am I gonna call you Ruby? So I'm gonna check your vitals first to see where we start out.
Okay, so about this mask, one of the precautions you got to worry about is disclosure. Any deposits of medication in the patient's eyes could irritate the eyes, as well as you got to make sure so that's one of the main precautions there. Also, the patient should be sitting in a more vertical position. So the medication, this valve here doesn't tilt back. If it tilts back, it doesn't really get delivered into the air. This aerolizes the medication. So the benefits of this is that the liquid medication gets turned into a gas. So the patient then can absorb the gas at a more precise way, and it gets to the airways of your lungs. So I'm going to go ahead and put that gas on right here.
I'm going to be checking that for 30 seconds, and then double it. So first hold.
Go ahead and tilt your head back, maybe help head forward.
I'm going to double that, so her pulse is actually 90 a minute. I check the respiration.
So about this whole thing, this whole procedure, it does take about 5 to 15 minutes. Also, it's good for patients who can't inhale greatly, has a poor inspiration flow. So this allows patients to relax and still get a good amount of medication without having to really use their lungs and breathe in. So this is a great way for patients not to have that ability, that has trouble breathing in. Okay. All right. Good job. Good job.
Okay, I'm gonna go underneath your tank top here so I can get a better listen, if that's okay with you.
All right. Good. BP is okay. All right. So I'm gonna go ahead and cut the procedure here. Let's say well, actually, when the procedure's almost done, when the medication's almost out of this SVN, it does spittle. It makes a little spittle sound, so a little dead space collects. So you can tap it, if you want, and try to get the remaining medication out of the device. Okay. Okay, Mr. Smith, good job. I'm going to go ahead and take that off now. Okay.
And on this side, I'm gonna reach underneath your
Indications that the medication's working, you see a mist coming out as well. Okay.
I'm gonna listen to your lung sounds on the front, so I'm gonna go underneath if that's all right.
And usually there's a bag for these. So in case the patient needs another treatment, it's convenient. It's where you left it at, so you could just put it in there, so you don't gotta go back and get a new one. Okay. So I'm pretend there's a bag here, and I'm pretend too this came in a bag as well, because they don't store them just like this. They store them in a pretty contained, nice sealed bag. Okay, so I'm gonna go ahead and put this right next to his bedside, or the bag should be here, I think, but I'm putting it on the bedside. Okay. Now my big thing I really want to know is I want him to try to cough out sputum. So again,
I would also note and check the color
about 5 to 15 minutes have passed. So I want to see if his airway loosened up enough to push out any sputum. Okay.
I'm gonna show you how to.
All right, Mr. Smith. I'm gonna go ahead and put my hand right here. Okay. You want to go ahead and cough? Okay, large as you can. Okay.
So we're just gonna push this down all the way, and you're gonna take a deep breath. You're going to inhale in as far as you can.
All right, yeah, we got some. Okay, cool. I'm going to put that in a container so I can just,
kind of like you're
so you'll
put this to your mouth and
get the viscosity, and the odor and the color and the amount. Put it in that little container here. Okay, so that's good. I'm going to do another assessment to see how beneficial the meds work. Okay, I'm going to start with the auscultation. I want to see that wheezing went away. I think it did too. Charles, I'm going to go ahead and turn you over, okay? I'm going to go ahead and put if you want again, put this right here.
Thank you so much.
Heart rate went up a little bit, but not too bad.
So I'm going to take the best one out of the three.
I'm going to go ahead and if you want to reach over again to your left side, the railing, I'm going to go ahead and do that. Go ahead and do that. I'm going to help you too, okay? Same thing, I'm going to check your chest and your back and your chest, okay?
Take that out. You want to warm it in your hands and shake it like this.
All right, I'm going to help you out, okay? I know you're having a hard time moving, so ready? Go ahead and grab onto that. 1, 2, 3. All right. Thank you. Good job, Charles. Good job. Good job.
What the spacer is going to do is this is going to help you so you don't have to coordinate your breaths, and so that you can just push the medication into the spacer. The medication will stay in here, and then you can inhale as much as you can, but pretty slowly. And then that way the medication has a chance to get down to your lungs. And then you're going to hold your breath for about 10 seconds. You are going to do this twice. So in between, I want you to wait about a minute. So this goes into here. Breathe out. Or you would, you would spray it. Oh,
okay.
We haven't used this.
All right.
And it's brand new.
It seems the wheezing went away.
Because we need to make sure again that we need to spray it once.
My first assessment, I checked the thyroid to see if it was any stridor, but it wasn't. But I'm going to check his... Charles, I'm going to check your neck as well. I forgot to check that for you, okay? Yeah, let me check that real quick. Go ahead, take a deep breath.
Press the medication, you'll see it fill up.
Yeah, he's good. Okay, so I did auscultation. I had him spewed him out after the assessment, right? Then now I'm going to go ahead and do the... I'll do the oximeter, respiratory rate breathing as well with the pulse, radial pulse. And then after that, I'm going to do the blood pressure cuff as well. All right, same thing, Charles. I'm going to go ahead and put this on your hand here. Okay.
So I want to have you put it together for me. Don't forget you need to press this so that the medication does fill.
Got it? Yeah, got it. Got his artery. Good arteries, Mr. Jones. Thank you so much.
Really slow so that it's not whistling at you. And then hold. Okay. And you want to actually, when you're releasing, you want to breathe out your nose so that you don't let any medication come out of your mouth. So you can try that on the next one. So again, you wait about a minute. Press the medication. Going to fill up in a spacer, you'll see it.
All right, thank you so much. Pulse ox.
Breathing in slowly and hold.
99.
Good job, you let it out through your nose.
BP.
So when you're done, you're going to want to
Actually, not BP. Heart rate.
So what you're going to do is disassemble it here.
So I count 15 seconds. It was at.
Or you can have it go through the dishwasher. You're going to rinse
it was at.
water, and then you want it to
was that?
You don't let it
15.
air dry.
15. So 15.
Stick something in there to try and dry it. You would create static, and therefore the next time that you use it, the medication's going to stick to it.
So 60 beats. 60 beats. I mean, his heart rate is 60. His pulse rate was 60. So you do see a decrease. Before it was 80. So a nice decrease there, and his respiratory rate I counted 4 in 15 seconds. So times that by 4, you get 16 respiratory rate. So that's pretty good. Now I'm gonna go ahead and get the blood pressure. Before it was at 135 over 90. So I'm gonna go ahead and see if there's a difference.
Your heart may start to race, and you might feel a little jittery.
All right, Charles, I'm going to check your blood pressure one more time, okay?
If
Thank you so much.
anything
You're
ever
really good.
happens, please let me know while you're doing it, or if it happens while you're at home, you want to call the doctor and let them know, because yes, that's something that's common, but if it's really bothering you, we may want to change the medication or give you a different type of mechanism to get the medication inside you by using like a dry powdered inhaler or a small volume nebulizer. So after you do that, I'm going to have you check. Actually, I'm going to check.
Place this right here. Place right here, okay, Ms. Jones? All right, thank you so much.
I'm going to have this back on your finger again. Thank you. And we're going to turn it on. All right, and let me see this one. Take it.
Nice.
So we do that for 30 seconds and then times it by 2. I got 45 for her pulse, but I'm going to times that by 2. It would be 90 for her heart rate. That's beats per minute.
Oh.
Compare it to here.
Oh, you're fine. You're fine. My finger just slipped. You're fine. You're totally good.
So that's pretty good. Her saturation has gone up, which is also great. This is now 97%.
Okay. BP's much better.
Respirations,
It was 120 over 80. So heart rate is. The heart's happier now. It's not working as hard as before. So your heart is working less. So it's very good sign. So yeah.
I also want to listen to your lung sound again.
Okay. Write that down.
So again, I'm going to go on your routine top.
Okay. Mr. Jones, do you need anything else before I take off? So you're doing well. I'll be if you need me. There's a nursing call, red button here. So you call the nurse, and they'll call me. There's one on that side as well. And I'm gonna go ahead and leave the call button.
Okay, I'm gonna go on this side.
Oh, there it is. I'll put it right here next to your side in case you need anything. Okay. So my name is Race. Yeah. Okay. So just get. I'm here to help. So get better. Okay. But I'm here with you. So give me a call if you need anything. Okay. All right. Thank you. That's tired. Okay.
Alright, great. Sounds a lot better.
Okay, now I'm gonna go ahead and start clean my items here, my pulse oximeter for another patient, and also clean my stethoscope as well. And
so remember, you're gonna take.
That's pretty much it.
Breath in as far as you can.
That's how you do your SVN. And thank you for watching.
Each time.